So hello and welcome. Thank you for coming. Appropriate that you should be here today. So we're going to talk about Zephyr, the new Zephyr HDR. So this is a culmination of 15 years of continuous development. The new Zephyr HDR continues where we left off with the old Zephyr HDR. Dan, yours is how old?
13 years.
13 years old. Right, so one of the very first ones. So 15 years later we have this, the new Zep 10 HDR. Some of the things that are a little different, we have a much larger imaging area. So the one that you have has 18-inch imaging area. We've now increased that to 24 inches. And it is actually now much lighter than it used to be, which makes moving the Zephyr a little easier to do. I'm going to lift the hoverboard. So the great thing about the Zephyr is that this is basically plug and play. So wherever you have a wall socket, an electrical outlet, you plug the blower into the wall socket and you're ready to go. So the Zephyr essentially comprises of three components. So we've got the hoverboard and the stirrups as first component. We've got the blower as the second component and the stretcher here. The blower plugs into the wall, so there are no batteries to worry about. No stress of, are the batteries charged? Do they need maintenance? Straight plug and play. So we can move the patient in the lithotomy position from the CT, PET CT or MR to the treatment table or treatment area. And so if you imagine this to be the CT, Dan, I'm going to hand this off to you. Maybe you can just reach across. And it's as easy as that. One person, but generally two, if you want. Yeah. No fingers underneath. Okay. And if you want to inflate it again, and then push back to me. Thank you. So the Zephyr comes with some accessories that you can see. So we have a body strap here for patient safety. We also have an armrest. So if your patient is under anesthesia, we have an IV pole as well. So we can put the patient's arm here. I'm just moving the table back into the... So we're going to move the patient into the treatment position. You see we have safety stops at the end of the procedural stretcher. So this particular procedural stretcher has the ability to do Trendelenburg. And Dan, maybe you want to come and also feel this. So these are the new gas stirrups. These are MR compatible. So maybe you want to feel what that's like. We have a universal clamp here. So whether you are treating with a cylinder or if you're doing a stepper, the stepper will attach to the rails, which is attached to the sled, to the hoverboard. These stirrups are maximum patient weight 350 pounds. With bariatric stirrups or footrest, we can do 450 pounds. And the stretcher itself is 600 pounds. So I'm going to move the patient back into a neutral position. Thanks, Lynette. Underneath the hoverboard, we have three air bladders. One round about her head and two at her hips. And the holes in the bladders vary, so there's a little bigger holes here, so there's more airflow because this is where most of the patient's weight tends to be. So instead of one bladder, it's proportioned depending on the patient's body and the patient's weight.